Welcome to the J3U University podcast. I'm your host, John Jewett.
And I'm your co-host, Luke Miller.
Our mission is to elevate the physique coaching standard
and deliver the highest level of competitors to the stage.
Let's jump into today's episode. Offseason Trifecta, growth hormone, insulin, metformin. We're going to dive into 3 question days surrounding the implementation of these 3 items. Do they all need to be together at once? Can they be individual? And how do we optimize our off-season to be fuel partitioning machines?
Yeah, hello, I think this is a great topic. I love this topic. I just recorded some content kind of around this, just with an episode that I did with a friend, doing a favor for, about like risk mitigation and potentially stack design for people kind of wading into PEDs. And I think where this has utility is GH and insulin is so often pushed. Like it's like, oh, you don't need that until you're in the pro ranks, or you don't need that until you're XYZ into bodybuilding. And I think there's so much value in answering some of these questions we have kind of around it, just to demystify it and show its utility, because this GH, insulin, metformin trifecta is extremely integral in a large percentage of our population that we work with. So, and I love these questions we have listed out. I'm ready to dive in.
I think a great introduction is our question number 1 being, how long post-show would you, or actually, yeah, no, that's cool. How long post-show would you wait to add in insulin and growth hormone? At first, when I read this question, and why I hesitated, because I thought it was like, how long would you wait in general before adding in growth hormone and insulin? And when I was first starting in bodybuilding, I always had the perception that growth hormone was like the game-changing drug. Yeah. And you like wait to play that ace card till you turn pro. Then all of a sudden you're going to be like 20 pounds heavier on stage. So we know that's not the case, but back to the actual question, what this person was asking is, how long post-show would you wait to add in these compounds? So I think with every drug that we're utilizing, it comes down to assessing what is your need for the individual in that particular phase moving forward. And a lot of times you have to assess what was the past phase and environment they were coming from. So if you think about pre-contest, what are you situation-wise? You're coming in from a very highly insulin-sensitive state, right? So the amount of insulin you're going to need to produce to manage all that glucose coming in from all your fun food is not going to have to be very much, actually, because you're so sensitive at the receptor level to insulin. So I pulled my lab work right after my show, looking at serum glucose, serum insulin. Fasted blood glucose was great. It was like, in the high 70s, and my insulin was like 1 point something, right? So extremely low amount of insulin needed to manage fasted blood glucose, and the same is going to be around meals. So the requirement right now, for one, of how much insulin I need to produce to cover the glucose excursions happening at meals is going to be very, very low, even though I'm going to have a large amount of food coming in. So the advantage at that point of trying to replace some of this insulin that I'm having to produce, it doesn't align well, it doesn't make sense. So insulin usually is the tool that we're utilizing when insulin requirements are now getting really high and you're getting a little bit less insulin sensitive and you're having to produce a lot more. This might be the case also when you're noticing hunger signaling is decreasing. There's also insulin secretion increases GLP-1, which decreases hunger and also GI transit. So usually if we're adding in insulin, people get a little bit of a hunger boost from that. So in that post-show phase, typically the situation doesn't necessitate the use of insulin because of the environment you're coming from. Now, Luke, maybe you want to take on the growth hormone piece of that.
Yeah, I think because, and I jokingly with the insulin portion say that just as to make it a bit more relatable in conversation, you are Humalog in that state, right? And it's you are the Humalog pin. You don't need the Humalog pin, right? So just in jest to basically point out that you're so sensitive that it's not going to matter. However, growth hormone does come in immediately post-show for the majority of my clientele. The one thing that I do kind of preface with this is, like, obviously its influence on renin, angiotensin, aldosterone, you're going to see a little bit of a jump in weight, which for some people psychologically can be a little bit tough. And so I do try to prepare my clientele for that increase in scale number, because a lot of people are pulling it, like heading into that show phase, right? We're pulling it 10, 14 days out. And so for those people who are dropping that out and reintroducing, that is like a psychological component I do try to manage off the forefront. But mechanistically, like, influencing GH IGF-1 with superphysical or exogenous GH introduction for me is just making the most of the least in an environment where it doesn't take much to progress, and we can improve health markers and progress with the minimal amount from an androgen standpoint by bringing in something that's going to make us more efficient from a progress standpoint. So for me, I'm always thinking post-show, how do I get this athlete to a place where I can do the least to get the most, to allow them to have the longest runway into the off season? And for me, by mediating progress through a separate pathway, accepting we're going to get jump in scale weight through that, fluid regulation aspect of it, is the best way to use the least amount of androgen to progress an athlete, where we now have the best health metrics on the back end of the post-show phase, or we get them to the best health metrics quicker so that off-season phase has the longest runway.
Yeah, I think that was the great point out of that is, in your prep phase, you're coming from a state of high androgen load with potential, deleterious effects. So what is the need for your post-show phase is to address all that systemic stress load and health effects that were occurring, which then requires low androgens. But we also want to build muscle too and take advantage of this post-show phase if able to. And so I think you bring up a great point of, like, bringing up growth hormone as another tool that's pretty low risk. And I think it's a great state to take advantage of it because you are insulin sensitive. And that is going to get to our next question of the stop point of being able to use a higher amount of growth hormone in the off season, because in this post-show phase, you're with low body fat, the water retention aspect is going to be to a lot lesser degree. And this is our kind of our runway into this next question of, is growth hormone best for bulking or more helpful on prep? And so again, it comes down to first assess, like, what is your need, requirements in that phase, and growth hormone, bringing that it has, for one, a mobilization of fatty acids that we can take advantage of. So it has a great point in prep. In off season, we don't have as much direct impact. There is some, a little bit from growth hormone, but around mobilizing fats, because it really comes down to, if you're not in a calorie deficit, you're not going to be able to do much with those mobilized fats. So growth hormone's more bringing them out to be used, but you still need to be able to do something with them. You're like, well, I do my fasted cardio, and then I burn them. But then if you eat more calories for the rest of the day, it just might be, reintegrating. So you're kind of bringing up the idea of maybe there's this partitioning aspect with growth hormone that would be enhanced in the off season, and maybe so, But I think it's the big picture. You still much harder to override if you're in a calorie surplus. Likely that's going to be a less impact of growth hormone causing some aid in fat gain. But we see that happen. But I think the big thing on prep is that using it fasted, you could have an increased mobilization of fatty acids and utilizing them. So there's that point. Now in the off season, the benefits more so from IGF-1 and all the synergies that happen to drive growth and increase protein synthesis and satellite cell proliferation and those components. So we say, I hate to say, is it best? Like, I guess if you're at gunpoint, Luke, and you're like, you can only use it in prep or in off season, what do you pick? Ideally, I'd say, like, I'll pick both. And then I, get shot and I didn't pick the A or B answer. But I think, for one, in reality, most people are going to be using it both phases. I think that comes down to what dosage limitations are you going to find in the off season? And in the off season, I know people have debated this a lot, but we've talked about this, that you likely will need your highest peak loads to drive growth versus in a prep. Now, it comes down to balancing out how much androgen to how much growth hormone you can do without running into the bottlenecks that you find for stopping your growth phase. So this might be someone that's running a lot of androgen in the offseason that leads to health markers decline, or someone's trying to run a lot of growth hormone and maybe that's leading to like more insulin resistance and hunger's dropping off, or just too much water retention to be able to assess your visuals. So it's kind of a balancing act of what setup can you run to cause the least health impacts but also drive progress. In prep, you are doing the same thing, but I think the advantage of prep, especially around like muscle retention, is that you could leverage more growth hormone because you're going to be getting leaner towards the tail end of prep, and it can keep some fullness as long as it's still not skewing those visuals. And I've kind of changed my viewpoint with like doing this open show is like once I got lean, I leveraged high amounts of growth hormone to keep fullness, and I didn't change the hardness that I had, and it didn't require a ton of androgen because of that. So I think in a certain part of prep, you might be able to bring up growth hormone to a higher level than what you were using the off season, because at some point in the off season, that high level of growth hormone, there's so much water retention happening, like it's hard to manage your blood pressure, hard to manage blood glucose, and then you're going to have to pull back because all that's going to come to a head where you need to address your health markers.
Yeah, I think if you held it at my head, though, if you held the gun to my head and said, Luke, you got to choose. It's prep or it's off season. I would choose off season because I want every variable into accruing new tissue, which to me is the much harder task than getting someone shredded and jacked. And if they've created the physique from accumulating the tissue in the off season by using every pathway to mediate progress in that phase, I've gotten tons of people shredded with the non-androgenics and some androgen load to retain tissue with good fatigue mitigation and good training protocols and being able to mitigate fatigue across prep with nutrition parameters and cardiovascular parameters. I can do that job extremely sufficiently. Accumulating new tissue at a certain point in someone's career becomes the hardest task as a bodybuilder to do.
I would definitely side with you on that for sure. And I know some people would flip that script and say, no, growth hormone in prep, but we do have to remember, like, what is the main role that growth hormone is having? Is it the best fat loss drug that you can take? I mean, I would absolutely take clenbuterol over growth hormone if I wanted to drive fat loss, or injectable carnitine, or using thyroid hormone. I mean, there's drugs that are made for fat loss directly. Growth hormone's not necessarily that drug. Really, where do we see growth hormone implemented in? It's in AIDS patients for muscle wasting, right? So where would it have the best application? Well, you say, "Oh, John, I'm wasting muscle on prep." You just said that. I was like, yeah, but there's a net protein, nitrogen balance we're trying to achieve when building muscle. Part of that is protein synthesis and also decreasing protein degradation. So in the off season, we still want to leverage both. And I would agree, like in the off season, driving up all pathways to make that growth happen. And then retaining tissue on prep is far easier. And a lot of times with a lot of people I work with growth hormone, it skews the variables too much to know if they're getting lean or not. So it's not also like making much impact at all for training performance, which we know if you can uphold training and prep, that's what's going to uphold tissue. So I think those are more the big players to use than having growth hormone. And so I would agree. I would have to pick the off season.
Don't get me wrong, it's fun when you're shredded. It was awesome watching you morph with however much I used growth hormone you were plugging in there towards the end. But I'm taking it off season over prep all day.
Yeah, it's I guess you could almost say I was almost a post show, in between phase. Do you even call it prep? I don't know.
Yeah, no, probably not because you're already shredded.
Yeah, but I would say dieting down, like when I did Atlanta, the 212 show, I had to eventually reduce growth hormone so I could accurately see like what was happening fat loss condition wise. And I think that's when we run into a lot of guys that they're trying to stay full and they're dieting and they're like, oh, we'll pull water the last week, and they drop out the growth hormone. They realize that it was still body fat. So it's part of the issue that could make an inaccurate assessment. So it's basically run as much as you can on prep without skewing those variables. And I know someone out there will be, well, how do you know? And that's a great question. Come to J3U. We will tell you. That question's for another day.
Shameless plug. To question 3. All right. I'm going to open this door and start with question 3 being, when putting a client on metformin, what variables or feedback do you take into consideration? So where do you start? I know where I start, but where do you start?
Yeah. So again, like Luke and I, we keep hammering this nail around what is the need. And what I don't want to look for is what is the protocol, because that's a lot of times what you probably got clickbaited into for our title here of the trifecta of insulin, growth hormone, and metformin, and that they must all be used together. But in actual clinical application, these aren't necessarily prescribed together. They don't come together. They're prescribed separately for the need of that situation, right? So that's what we have to assess in our client is, what does that person need from, is it a muscle growth aspect or fat loss? Is it something around, mitigating some of the health effects that were occurring in bodybuilding? And then we might use a lot of other tools to bring that forth before we even make this first step into using something like metformin. So when you bring up metformin, you have to say, like, and this is why we like, how do things work and what do things do? Because it's typically used in type 2 diabetics for just lowering blood glucose in the simplest terms possible. However, metformin does bring a lot of other great attributes to it, and why that even matters around type 2 diabetics and bodybuilders is that in certain bodybuilding situations, you're exposing yourself to the potential of insulin resistance with high body weights, high amount of visceral fat transition, increased inflammation, increased oxidation, using high amounts of growth hormone, high amounts of foods. All of this leads to just this accumulation of what could be a metabolic disorder in bodybuilders. And we see health deleterious effects occur with lab markers. And just what does it lead to over time? Like, what do you look at when you see insulin resistance or dyslipidemia or high triglycerides? I mean, all these things lead to mortality, comorbidities that lead to mortality, right? So in bodybuilding, our need is when we get to that level, like a diabetic would, to help keep some type of fuel partitioning optimal, keep insulin resistance at bay. But also what we do see with metformin use in these patients, and even in non-diabetics, because there also is some anti-aging aspects, some anti-cancer aspects around metformin, is that there is a improvements in overall cardiovascular metrics. Also decreases is not even from how it regulates blood glucose, but direct effects on metformin on decreasing inflammation. One interesting one is neuroinflammation, which actually has been like on my mind a lot lately. See what I did there? Just, my mother has dementia. The risk of using steroids could lead you to higher risk of neurodegeneration, increases of beta amyloid, plaques, inflammation in the brain. And metformin has direct and indirect effects on decreasing neuroinflammation in the brain. Then on top of it, bringing its effects on improved, lipid profile, overall decreasing inflammation systemically, and on top, improving insulin resistance, would have great application for someone that's bodybuilding and really pushing it to that level where we're seeing these markers now getting skewed. And so now we come to the answer, right? We're seeing someone that's presenting a risk level that has skewing of markers for inflammation, blood glucose alterations, and high serum insulin levels. That would be the person where We've already done everything else, right? They're doing their cardio, they have sleep, they're stressed. We have a great, colorful diet that they're implementing with great, anti-inflammatory components and antioxidants present. And we're doing all this, and maybe we've even implemented some even more minuscule aspects around blood glucose management, some different supplements. That's still not impactful. Metformin would then come into place, and you very well could make a case that if you're someone that has moved into super physiological territory and you're absolutely going to be presenting these risks to yourself, that you might consider using metformin at the lowest effective dose possible as a prophylactic mean. And I know a lot of people struggle with that, but risk versus benefit, right? The risk of taking super physiological amounts of androgen is relatively high. What is the risk of adding a small dose of metformin versus the benefit? I think with someone who's taking a polypharmacy of PEDs and adding one more thing that might actually have some benefit, I feel like that benefit outweighs any further risk that compound might bring if we are able to extend our lives past bodybuilding, when there's a huge question mark around the current usage of bodybuilding over the past even 15 years. Is that a wild amount versus even looking 20 years ago, and those guys still haven't even gotten to old age yet. So we don't even know. We don't even know the impacts of what this stuff is occurring. And so someone's going to push back on using a small amount of metformin if it could in some capacity lead to less neurodegeneration or improved cardiovascular outcomes or kidney outcomes. I feel a little bit more strongly. I'm getting on my soapbox here about using it as a prophylactic at the lowest effective dosage. And then if we're seeing markers still skew beyond that, then we start escalating to treat those pieces. And we're not doctors, and we're not treating conditions. Your doctor is guiding you in this, of course, but that would be at least some of the rationale of setting a framework for everyone of how you might use this, why you might use it, and assessing along the way of when that becomes a tool to be utilized. I don't know if I left you for anything you need to say, Luke. I'm sorry. I just kept talking.
Man, if there's something you learn about me, it's I can pull something out of nothing. So here we go. This is more kind of speaking to the coaches and the coach dialogue, because on top of the other things I mentioned to you off camera, this has been where my brain's been heavily is. So we walk through the why, we understand the why. It's how do we communicate the why? And I think for a large percentage of you watching are coaches, I think it's important to understand that someone critically thinking and asking questions about whether metformin is a necessity within a stack design is a good question from their end, because at least they're actually critically thinking. Someone who is married to a medical practitioner understands the line of logic, because this is constantly what we argue about, that all medicines come with side effects. And so when we go down that line of logic, we have to understand that someone asking the question of, hey, is this even necessary, is not from a communication standpoint, them being defiant. It's from a desire for them to want to understand. As coaches, our role should be to take that and affirm that question and present the options of the risk and benefits that John just laid out, and then map out that process of why we are doing this as risk mitigation, and potentially even presenting populations that show proof of concept as to what long-term this could be from a detriment standpoint in potentially presenting type 2 diabetics literature and things along those lines. So just as coaches from a communication standpoint, I would urge you to take this why and use it to affirm people who are critically questioning potentially the implementation of it, and provide the logic and move them into a place of understanding, yeah, sure, polypharm, when we talk about general population, is not the norm. It gets semi-normalized in bodybuilding, but there's reasons why, and it's for risk mitigation when we've accepted the fact that drug use is a part of our sport.
Can I tell you a story, Luke?
Yeah, story time.
Story time. First time I took metformin was right at the December-ish, I remember this, of 2016. I was moving into off-season. Matt Jansen was coaching me at the time. He's the first one that told me, or not told me, but brought up the idea of hey, would you want to utilize this tool, Metformin? And he said this to me, and right away I, of course, jumped onto Google to search and learn everything about it. I was like, why would I take Metformin? Like, there's such a hesitation around a drug used to treat a disease, right? Like, I would never take a blood pressure medication, but I would take all these other drugs without even a question. So I had all these questions at first, and Matt said, Luke Sandow came to me, and he's been running Metformin in his offseason. And then I look at Luke Sandow. I was like, well, this guy's like 300 pounds. He's huge. Because my first concern was like, I think it might cause some less muscle gain. He's like, there's no way that I've seen this in coaching. Like, look at Luke. He's like, it's only been beneficial around him. So that was the first time I actually utilized it. And again, this was like 8 years ago. It's before everyone even really had jumped on the bandwagon and become more mainstream. Like, we have been using these things for a while in bodybuilding, but the aspect around, like, is it going to stop muscle gain or anything? It's like, man, you're driving so many other variables that are going to build muscle. Like, that's not even the concern here. It's more to continue to optimize fuel utilization and as a prophylactic mean to mitigate health and allow you to extend those growth phases even longer. So that was my quick story of like the first time that I used it. But to your point, as an athlete, I brought up like the hesitation and pullback of seeing something new that I wasn't familiar with. And I needed those questions answered of, why is this being used? Like, what are the pros and cons of it? And, you know, Matt gave me those and made me feel comfortable with it. And it was utilized then. So for your clients that, you know, Luke brings up, like, it's an education piece. If you're going to bring new things around that they haven't seen before, you're going to have to be able to back up the whys behind what you're doing.
Yeah. In fact, if you're at the VIP lecture and watched it, you'll know that I gave my soapbox on that throughout the entire VIP lecture. If not, you should go sign up.
Yeah.
There you go.
Well, cool, guys. Well, thank you, everyone, for tuning in to the podcast, and we will talk to you next time.